How's it going, everybody? This is Ryan, and today I wanted to talk about the top three most common injuries to the lumbar spine that leads to severe low back pain and even sciatica. And I want to talk a little bit about the treatments that are highly effective for every single one of those conditions we're going to be talking about. So, one of the most common injuries to the low back are bulging and herniated disc. Second most common finding is lumbar spondylosis, which is an arthritic change to the spine and also leads to degenerative disc disease. And the third most common finding is spinal stenosis. So I have some good video clips I'd like to share with you all. And while we go through that, I'd like to talk about what conservative treatments are highly effective to treat every single one of those. And you've probably heard me talk a lot about it already. It's called directional preference stretching, that is highly effective and great treatment approach for every single one of those and reduces people's pain incredibly fast. And this is what I do for every single one of my patients. So let's dive right in. I'm going to share my screen with you all, and we're going to go over in detail on exactly what those three conditions look like as far as bulging disc, spondylosis, and stenosis.
Low back pain is common and can make everyday tasks such as bending or twisting difficult. A herniated disc may be a cause of your back pain. The lumbar spine is found in the low back and connects the thoracic spine above and the sacrum below. The bony spine protects the sensitive spinal cord. The bones of the lumbar spine have a cushion between them called the intervertebral discs. The disc has a tough outer ring called an annulus, and the center of the ring has a soft jelly-like substance called the nucleus pulposus. Just behind the disc, you can find the spinal cord and the spinal nerve roots, sensitive structures that carry messages. If the nucleus of the disc is injured and bulges against the outer ring, back pain may occur. If the nucleus pushes all the way outside the ring, or herniates, you may feel other symptoms such as leg pain. With a herniated disc, you may feel pain, numbness, or muscle weakness in the low back, buttocks, or in the leg.
Okay, so that right there talks about bulging disc and what it looks like inside the disc, right? So when the disc starts to bulge, you see that nucleus in the middle starts to bulge out towards the outer annular fibers. If the disc is just bulging, that's actually quite okay and normal. Um, and people have a great prognosis with conservative treatments like physical therapy and definitely directional preference stretching. Of course, it's a little bit more complicated if the disc has a full-on herniation and the nucleus is coming out of the annular fibers. That makes it a little bit harder, um, but still, the directional preference stretching protocol will not change. And I just want to talk a little bit about what directional preference stretching is. So when people have an injury like a bulging disc, one of the common uh, traits that they all share is they have a lot of pain with prolonged sitting. If they bend, that causes a lot of pain because when they bend, it only allows that disc to bulge even further or even herniate further. So the directional preference that they don't like is forward bending. So on a directional preference routine that they tend to benefit really well from is more of an extension bias direction, which makes the pain a whole lot better. So their directional preference to make their symptoms a whole lot better and to reduce their pain fast is more of an extension bias where they can lay on their stomach and press up. That's one direction. And the second most common is called side glides, where you kind of do a lateral side to side stretch depending on where the injury is, left side versus right side injury. So that is for the uh, bulging and herniated disc example. Now let's move on to the other common condition. Get out of here. So we're going to talk about spondylosis.
Spondylosis is a general term that describes wear and tear in your spine as you age. It is also known as arthritis of the spine. It can occur anywhere in the spine, but it is most common in the low back or lumbar spine. When spondylosis occurs in the low back, it is called lumbar spondylosis. The bones of the spine are called vertebrae, and they protect the sensitive spinal cord that travels in the center of the spine. The bones of the spine have a cushion between them called intervertebral discs. Just behind the discs are the spinal cord and the spinal nerve roots, structures that carry messages. The nerve roots and spinal cord are very sensitive. Any pressure or irritation of the nerves may cause pain. With aging or injury to the low back, the discs between the vertebrae can shrink in height and lead to a decrease of space in the areas where nerves travel. As the discs break down, the vertebrae may grind against one another, leading to friction, local inflammation, a loss of mobility, and sometimes the formation of bone spurs. Symptoms of lumbar spondylosis vary depending on which structures are affected. Most people, however, experience back pain and stiffness. If nerves are pinched, other symptoms such as tingling, numbness, or weakness in the buttocks area and legs can occur. More severe symptoms may include difficulty walking and changes in bowel or bladder function.
Okay, so now you had a good visual on what spondylosis is. Like the video described, the bones get more arthritic changes. And then when that happens, the discs start to get degenerated as well, um, putting more pressure on the surrounding nerve roots. And that's when people get a lot of low back pain or even a pinched nerve feeling like sciatica. So, how do these people benefit from directional preference stretching? Similar to the bulging disc idea, but with spondylosis, sometimes it's not as predictable as which directional stretch because their symptoms can vary significantly from one person to the other. For example, people with spondylosis might say that backward bending makes them feel a whole lot worse, and forward bending makes them feel better. And then the next person could have very different symptoms. Backward bending can feel great, forward bending hurts. So everyone's directional preference stretch can be polar opposites. However, they can still benefit from directional preference stretching. We just have to start with a clear conversation with the patient on what's increasing your pain, what's increasing and decreasing your pain, and go through an assessment, which is really the evaluation. It's a test. We have to kind of put the person through different movements, see what's making them feel better, what's making them feel worse, testing some of these different directional preferences of stretching. So they might test some extension biased approaches first, see how they respond. If that's not working, then we need to move on a different directional preference stretch. So essentially, there's extension versus flexion. Test those two. Then that lateral side gliding approach, whether you're going to the left, going to the right, that's the other approach. And then the final one that's not used as often is more of a rotational approach. They can also centralize the pain, which means reduce the pain. So there's different steps that you have to kind of test. Essentially, it doesn't take that long, less than an hour of initial assessment, and then the person will just go through the protocol accordingly right after the assessment, and just keep having follow-ups every couple of days or so, and then within maybe 2 weeks on average, it'll be clear how they're responding and what is their ideal directional preference stretch. Okay, so I'm going to move on to the third and final most common cause of low back pain, which is stenosis. Stenosis, okay.
A common cause of leg and low back pain is lumbar stenosis, a type of spinal stenosis. Spinal stenosis is the narrowing of the spaces in the spine, causing pressure on the spinal cord and nerves. Lumbar stenosis is spinal stenosis of the low back or lumbar region. As you age, your spine changes, which often leads to wear and tear of the bones, discs, muscles, and ligaments that make up the spine. These changes may lead to lumbar stenosis. The lumbar spine is found in the low back and connects to the thoracic spine above and the sacrum below. The bony spine protects the sensitive spinal cord. The bones of the lumbar spine, known as vertebrae, have a cushion between them called the intervertebral disc. The disc has a tough outer ring called the annulus fibrosus, and the center of the ring has a soft jelly-like substance called the nucleus pulposus. Just behind the discs, you can find the spinal cord and the spinal nerve roots, sensitive structures that carry messages. As the body ages, natural wear and tear may cause the vertebra, the discs, and the spaces between them to shrink in height, which narrows the spinal canal. This compression and narrowing may place pressure on the sensitive nerves in the spinal canal, resulting in back, pelvic, or leg pain, and possibly a loss of strength. Symptoms of lumbar stenosis often worsen with prolonged standing or walking. Leg burning or cramping are common, and with more severe symptoms, loss of strength and tingling or numbness in the legs may occur.
Okay, so now you had a good visual on what stenosis is. It's kind of like spondylosis, that arthritic change. But there's a canal that starts to get smaller and smaller and starts to bite down on the nerves. That's the stenosis part. Now, how do these people respond to directional preference stretching if that's their cause of pain? Well, the first question is it varies on how severe the stenosis is. On a MRI report, it'll give it a range from mild, moderate, or even severe stenosis. And again, how do these people benefit from directional preference stretching? Well, they do all the time, but you have to again put them through the test, and it depends on the severity of it. Similar to the spondylosis group, sometimes every individual can be quite different on how they respond to this approach. But if they're on the more mild to moderate side, they might actually benefit from an extension-based approach. However, the people that have more of a severe stenosis approach, backward bending could really bite down on the nerve and trigger their sciatica. Long story short, though, they really could benefit from an extension or flexion biased approach. It really depends on the severity of it. Every patient just has to go through the assessment portion, just give it a little bit of time, test certain movements. But again, it only takes a short amount of time to really hone in on what directional preference is best for them. And the patient just does it. And in a matter of a couple of short weeks, it's very clear on what's working and what's not working, and on how to continue and progress their recovery. So that's what I wanted to talk about today. Please let me know if you have any questions on today's topic on directional preference stretching and how this may apply or how this could help you. There are, of course, other causes for low back pain like spondylolisthesis or scoliosis. Those are other common things, maybe not quite as common. But again, directional preference stretching is a high recommendation for all those cases. But again, just let me know if you have any questions. Leave some comments here. You can email me or message me directly too if you have any questions about this, okay, and how this can help you. But again, this is my approach for all my patients, and this is what just gets consistent, fast results. And I'd love to help you all with this too. Just let me know. I'm here to help you guys anytime. Just let me know, and I'll talk soon. Okay, bye.